My name is Jeremy Hsu. So I'm a general surgeon by training, but I have subspecialty training in trauma and surgical critical care, as well as breast oncoplastic surgery. I work in a level 1 trauma centre, which is also a quaternary referral academic centre in Sydney, Australia. In terms of when approaching a trauma patient, so someone that's been injured, really it comes down to a set of standardized algorithms. The key thing about trauma is that you've got to make decisions quickly because you need to stop the bleeding, you need to make sure that they're getting oxygen, you want to prevent any complications that may occur. And so therefore it's quite standardized so that you don't miss anything. So it's kind of working out the severity of the injuries, what's likely going to cause harm to that patient, and what we can do about it. Actually, at the hospital where I am, it has a long history. It's like one of the first trauma centres in Sydney. There were great mentors that had established the program, but like every sort of good program, to grow and to kind of evolve, you need to bring back new ideas, implement new ideas, different approaches, different techniques, and and that's part of the reason why I went to the US to get further specialist training, like at a super busy centre, so they can get more training in systems, operative techniques, decision making and the like, and I think that's how the service has evolved. There's always that balance between unplanned surgery and admissions versus the elective. And when you're in a hospital like where I am, where you've got, as I said, it's a quaternary referral academic centre, so you've got every specialty there, you only still have a limited number of operating rooms. A lot of my time has been spent kind of changing the perception and the culture in terms of making trauma into something that the hospital, or trauma care, into something that the hospital takes pride in. And because trauma involves so many different areas, and the patient is likely to go through 3, 4, 5 different areas within the hospital and encounter maybe 50 different people during their stay, every member of that team is important, of the hospital team is important. And so now I'm really happy because when people talk about the hospital and about dealing with trauma, they're proud to be part of that. And that's the really big cultural change, it's part of what we call core business. If your particular institution has been designated or is responsible for taking care of trauma patients, then that's something that you have to get everyone on board with, to have every person in the hospital understand that trauma is a key part of the work that is done. There's certainly been published data on the fact that being a trauma centre has a halo effect. You actually can improve outcomes in other areas of surgical practice within that institution if you do your trauma care properly.